Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to your second lecture in the central nervous system. In this lecture, we will discuss the development of different parts of the central nervous system and the congenital anomalies that result from defects in the process of normal development of each part. This lecture will be presented by me, Dr. Maha ELBeltagy, Anatomy and Histology Department, the University of Jordan. So, the development of the central nervous system begins around the third week of intrauterine development. By development of a tube, this tube is called neural tube. So, how can the neural tube be developed? The first step begins by thickening of the ectoderm in the middle of the trigeminal germ layers. So as you know, the trilaminar disc develops very early after the implantation as ectoderm, mesoderm, and endoderm. The thickening of the ectoderm is known as neural plate. So the first step is formation of neural plate. The neural plate is like thickening in the surface ectoderm of the embryo. The notochord, which is this part, is the triggering factor of this process. So the notochord lies posterior to the ectodermal thickening, which will form the nucleus pulposus of the intervertebral disc between the vertebrae. So this notochord begins the process of ectodermal thickening and neuralization. This notochord lies posterior to the surface ectoderm, and the surface and this notochord itself will develop into the nucleus pulposus, which lies inside the intervertebral disc between the two vertebrae. The neural plate invaginates towards the notochord to form the neural groove, and this is the second step. So the neural thickening, which is this part, invaginates inside the surface ectoderm towards the notochord and will form a groove called neural groove. And the lips of the neural groove, these parts, approaches each other. So the lips approach each other and fuse to form the neural tube. So the lips closes, this cavity here, the lips closes, and the neural tube now sinks inside the surface ectoderm. So the surface ectoderm is covering the neural tube, and the neural tube now lies completely under cover of the surface ectoderm. Remember that these lips, which are red in color, remains separate from the neural tube, and they are forming neural crests. Neural crests will give rise to spinal ganglions and also some structures like melanocytes, and other structures will be discussed later. The neural tube now has an anterior and posterior openings called neuropores. So the neural tube will be like this, with anterior and posterior opening. These openings are closing at days 25 and 27 respectively, transforming the tube into a closed tube. So this one closes as 25, and the posterior neuropore closes at 27 days of 25 and 27 days of intrauterine life. Now this is the shape of the neural tube. This is the proximal part, and this is the distal part of the neural tube. The proximal part will be developed into the forebrain and midbrain and hindbrain vesicles, which are parts of the brain, which will form the brain and the brainstem and cerebellum. The distal part of the neural tube, which is this part, will be developed into the spinal cord. So what is the process of development of the spinal cord? Now we have a closed neural tube, which is lined by one layer, this layer called neural matrix. So if you have a cut section in the neural tube, this is the shape, and this tube will be lined only by one layer. This layer is called neural matrix. This neural matrix will divide and divide again, leads to increase in the length and the diameter of the neural tube. So the neural matrix will be divide and divide again, and this leads to increase in length and diameter of the tube. During the course of division, cells migrate to the periphery of the tube. So this is this arrow indicates the direction of cell division and migration from inside to the periphery of the neural tube. The end result, we have three layers: inner layer and intermediate layer and outer layer, or inner zone, intermediate zone, and outer zone. The intermediate zone will form the gray matter of the spinal cord. So this zone will be the gray matter of the spinal cord. If you remember the spinal cord, if you have a cut section in the spinal cord, this will give you inner H-shaped color of gray. This layer indicates the gray matter, and the outer part is white, and this part stands for the white matter or the tracts of the central nervous system. The neuroplasts, which are the earliest stage of the neurons, will give rise to the nerve fibers that are extending to the periphery of the tube, forming this layer, which is the marginal zone or the external layer. So this layer lies outside the intermediate zone and called marginal zone, which will be which will develop into the white matter of the spinal cord. Also, some neuroplasts will develop into the neuroglia, which are astrocytes and oligodendrocytes. They are the other forms of the glial cells. Microglia also, which is responsible for the defense mechanism in the CNS, is developed from the surrounding mesenchymal tissue. Now, the cells which are in the lateral wall of the neural tube will differentiate into three layers. The inner matrix layer, which is this layer at the end of the development, the inner matrix layer or the inner ependymal layer. This layer will lines the central canal of the spinal cord and lines also the brain ventricles. The intermediate layer, now called mantle layer, so the mantle layer stands for the middle or the intermediate layer of the neural tube. This will form the gray matter of the spinal cord, and the outer marginal layer, which forms the white matter of the spinal cord. So this is the inner ependymal layer, and this is the middle mantle layer, which will form the gray matter, and this is the outer marginal layer, which will form the white matter of the spinal cord. The lateral walls are connected by roof plate, this part, and floor plate. The roof plate is lying dorsal to the neural tube, and the floor plate is lying ventral or in the anterior side of the neural plate. Next step, groove is developed in the cells of the lateral wall of the tube. This groove is called sulcus limitans. So in this way, a groove is developed inside the lateral wall of the neural tube, and this groove will divide the tube into dorsal part and ventral part. The dorsal part, which is this part, will form the alar plate, and the ventral part will form what's called basal plate. So the alar plate will extend dorsally to form the posterior horn cells or the posterior root of the spinal cord, and the basal plate will extend ventrally or anteriorly to form the anterior or the motor horn of the spinal cord. The cavity of the neural tube narrows to form the central canal of the spinal cord. We know that the spinal cord and the brain are covered by 3 layers. From inside outside, they are called pia mater, arachnoid matter, and the dura mater. These layers are called the meninges of the spinal cord. But how do they develop in the spinal cord? If you remember from the general embryology, the layer of the mesoderm, which surrounds the neural tube, is called paraaxial mesoderm. So if this is the neural tube and this is the mesoderm, so this layer of the mesoderm which surrounds the neural tube is called paraaxial mesoderm. The paraaxial mesoderm will be subdivided into somites or segments. These somites are subdivided into sclerotomes, myotomes, and dermatomes. The sclerotome will give rise to the vertebral column and the cartilage. So it gives rise to the bone itself of the vertebral column and the cartilage between the vertebrae, and also it gives rise to the meninges, which we are discussing now, that surrounds the spinal cord. These meninges are separated by spaces. So as you know, the subarachnoid space between the arachnoid and the pia mater, this will develop as a cavity between these 2 layers, the arachnoid and the pia mater. And later it will be filled with the cerebrospinal fluid. It is also important to know that during the first 2 months of the intrauterine life, the length of the spinal cord is the same as the length of the vertebral column. This is early in the first 2 months of the intrauterine life. At birth, the coccygeal end of the spinal cord lies at the level of lumbar 3 vertebrae. So the lower end of the spinal cord, or the coccygeal end of the spinal cord, lies at the level of lumbar 3. But in the adult, the lower end of the spinal cord lies at the disc between lumbar 1 and lumbar 2. So the lower end of the spinal cord in adulthood lies here in the disc between lumbar 1 and lumbar 2. And this lower end of the spinal cord is called conus medullaris. This lower end here is called conus medullaris, and the nerves below this level are called coda equina or horsetail. So all these nerves here are called coda equina, and the terminal part of the spinal cord have a tapering end like this, has a tapering end, and this called conus medullaris. Here in this slide, this table shows you or enables you to know the level of each segment of the spinal cord compared to the vertebral level. as we said before, that the spinal cord terminates at the lower end of the lumbar 1 vertebrae. So it's important to know the level of the segment of the spinal segment in relation to the vertebral level, and this table shows you gives you a general rule to calculate these levels, and this will be discussed in details in your spinal cord course. Now, what are the possible congenital anomalies that could occur in case of abnormal neural tube development? The most common abnormality in spinal cord development is what's called spina bifida. The spina bifida means absence of the vertebral arch or the vertebral bone while the spinal cord develops normally. So if you see this picture here, this is the vertebra, and this is what's called vertebral arch. So in the normal development of the vertebrae, you have the spine in the vertebral arch, in the posterior part of the vertebral arch. These are the transverse processes, and here is the body of the vertebrae, and this is the spine of the vertebrae. If this part fails to develop, this results in the spina bifida. This is the spinal cord here. This part is the spinal cord, and there are types of spina bifida. The first type and the most common type is the spina bifida occulta. In this type, the spinal cord lies inside the vertebral. The spinal cord lies inside the vertebrae, and there is absence of the posterior part of the vertebral arch, and this is obvious in babies as a hairy skin. So some hairs you find in the lumbosacral region. This is the most common site of the spina bifida occulta, in the lumbosacral region. As you see, there is absence of the vertebral arch, but the spinal cord keeps inside. The second common type of the spina bifida is the spina bifida cystica. In this form, there is absence of the development of the vertebral arch as well, but the spinal cord, so there is no vertebral arch, but the spinal cord inside also is affected. This is the spinal cord, and these are the meninges that surround the spinal cord, and this is the subarachnoid space, which is filled with the cerebrospinal fluid. So if only the sac of meninges protruded from the defect of the vertebral arch, this is called spina bifida cystica. So only sac, which is filled with the subarachnoid space, is protruded from the defect, also in the lumbosacral region, and this sac does not include the spinal cord. The spinal cord is protected inside the vertebral arch, the proximal part of the vertebral arch, and there is no protrusion of the spinal cord itself inside the sac. This phenomena is called meningeocele. We have another more dangerous abnormality, which is called meningio-myelocele. So meningio means meninges, and myelo means spinal cord, and cele is the sac which contains the cerebrospinal fluid. In this condition, we have both the spinal cord and the meninges are protruded inside the sac, which is filled with the cerebrospinal fluid. And sure, this is more dangerous than the meningeocele. This is called meningio-myelocele. In more severe cases, there is failure of obliteration of the neural tube itself. and the spinal cord itself is protruded from the defect, and this is called myelocele. So myelocele means protrusion of the spinal cord itself without any meninges. The spinal cord itself is affected due to failure of obliteration of the neural tube, and this is a very severe case. Now, how is the brain itself and the brain stem are developed? To answer this question, we have to go back to the neural tube at early stages of development. The cranial part of the neural tube is developed into three vesicles called forebrain vesicles. The forebrain vesicle, which is the proximal part of the neural tube, this is called prosencephalon. So the first brain vesicle to develop is called prosencephalon or forebrain vesicle. The second one is called midbrain vesicle or mesencephalon, and the hindbrain vesicle or the distal one, the rhombencephalon. This is the distal part of the vesicles which are developed in the brain. So this is the forebrain vesicle, and this part here is the mesencephalon or the midbrain vesicle, and this part here is the rhombencephalon or the hindbrain vesicle. The forebrain vesicle will form two lateral vesicles. They are later developed in the two cerebral hemispheres. These vesicles are called telencephalic vesicles. So the forebrain vesicle gives rise to two lateral vesicles which are called telencephalic vesicles. These will be developed into the cerebral hemisphere, and there is a median vesicle which is called diencephalic vesicle, which also developed from the forebrain, and this vesicle will be developed into the diencephalon, and this will be kept between the two telencephalic vesicles to form the diencephalon and the cavity of the third ventricle, which lies between the two thalami or the two parts of the diencephalon. So the forebrain vesicle will give rise to three brain vesicles, which are called telencephalic vesicles, lateral two telencephalic vesicles, and median vesicle, which is the diencephalon or the diencephalic vesicle. Then the other vesicle or the middle vesicle, which is the mesencephalon or the mesencephalic vesicle. This will be developed later into the midbrain, and a cavity will be appearing in the center here, and this cavity will be the cerebral aqueduct of Sylvius, which connects between the third ventricle above and the fourth ventricle below. The last or the hindbrain vesicle is this part. This is called rhombencephalon. Rhombencephalon. This part will be developed into pons, medulla, and the cerebellum, and a cavity inside the rhombencephalon will be developed to be developed later into the cavity of the fourth ventricle. The rhombencephalon, which is the hindbrain vesicle, will be divided into two vesicles. The rhombencephalon will be developed into metencephalon and myelencephalon. The metencephalon will be developed into the cerebellum and the bones, while the myelencephalon will be developed into the medulla oblongata. So if you look at this table, which represents different vesicles of the brain and the derivative of each vesicle, so for example, the primary vesicle here and the secondary vesicle here, and these are the derivatives of each vesicle. So the proximal vesicle is called prosencephalon. So the prosencephalon will be developed into two telencephalons and one diencephalon between the telencephalon vesicles. The telencephalon will give rise to cerebral cortex and cerebral white matter, and also the basal nuclei inside the cerebrum. The diencephalon will give rise to the thalamus and its family, the hypothalamus, the subthalamus, the epithalamus. The mesencephalon vesicle will give rise only to the midbrain and the cavity inside, and the rhombencephalon, as we mentioned, will be subdivided into two vesicles. Metencephalon, the proximal part of the rhombencephalon, which give rise to the cerebellum and pons and part of the floor of the fourth ventricle, and the distal part will be the myelencephalon, which will be developed into the medulla oblongata with the distal part of the fourth ventricle. Now we will discuss the development of the brain stem different structures. First, we will discuss the development of the medulla oblongata, which is the distal part of the brain stem. If you go back to the table, the medulla oblongata is developed from this part, which is the myelencephalon. And the myelencephalon is a derivative from the rhombencephalon, as it divides into two parts, as we mentioned before. The distal vesicle of the myelencephalon, the same development of the spinal cord, the same steps are occurring in the development of the brainstem. So if you remember, we have an alar plate which lies dorsally in the spinal cord, and basal plate which lies ventrally in the spinal cord, with the central canal inside the spinal cord. So in case of the medulla oblongata, we have also the alar plate which lies dorsally, and the alar plate will give rise to the sensory nuclei that lies inside the medulla oblongata. The basal plate lies ventrally. This will give rise to the ventral or the motor nuclei of the medulla oblongata, and the central canal will give rise to the cavity of the fourth ventricle. If you remember, in the spinal cord, the alar plate and the basal plates are connected by a roof plate. So this is the roof plate in case of the medulla oblongata. But what happens in the medulla oblongata is that both alar plates are separated to the lateral sides, stretching this roof plate to form the cavity inside. This cavity will be the cavity of the fourth ventricle. So the cavity of the fourth ventricle is developed because of a stretching of the roof plate laterally. And the sulcus limitans, which appears also in the spinal cord, this will divide the sensory and motor nuclei of the spinal cord, as well as in case of the medulla oblongata. So the alar plate, as we said, will give rise to the sensory nuclei, and the basal plate will give rise to the motor nuclei of the medulla oblongata. Also, between the 4th and 5th months of the intrauterine life, the connection between the fourth ventricle and the subarachnoid space are developed, which are the foramen of Meninges, median foramen of Meninges, and two lateral foramens of Loschka. This will be developed in the roof of the fourth ventricle, and you see here the choroid plexus also is developed in the roof of the fourth ventricle. This is the development of the pons and cerebellum. The same steps developed as in the spinal cord. So first we have to know that the pons and cerebellum are developed from the metencephalon vesicle, which is the secondary vesicle of the rhombencephalon, the proximal part of the rhombencephalon. So we have two alar plates which are lying dorsally, and the basal plates which are lying ventrally, and the cavity inside the central canal which will be developed into the cavity of the fourth ventricle later on. What happens in case of bones, that the alar plates will develop and move medially to form what's forming to form what is called rhombic lips. So the alar plates, which are situated dorsally, will develop into these rhombic lips, and these rhombic lips will enlarge and approach each other to form the cerebellar plate. So this is the direction of enlargement of and diffusion of these rhombic lips, and these rhombic lips here will form the cerebellum. So this is the cerebellum, or the future cerebellum. Then the cerebellar plate itself will differentiate into medium part. This medium part will be the vermis, which connects between the two cerebellar hemispheres, and the basal plate, which is lying ventrally, will form the pons. So the basal plate will develop into the pons, and the dorsal plate, or the alar plate, the dorsal plates will develop into the cerebellum, and the cavity between the dorsal and ventral plates will form part of the floor of the fourth ventricle, which is the proximal part. The midbrain is developed from the mesencephalic vesicle of the neural tube. As usual, we have an alar plate and basal plate. The alar plates will develop into the dorsal part of the midbrain, and the basal plate will be developed into the ventral part of the midbrain. So the dorsal part of the midbrain is called tectum, and the ventral part of the midbrain is called tegmentum. And the cavity between the ventral and dorsal part is the narrowest part of the connection of the ventricles. It's called cerebral aqueduct of Sylvius. So the tectum will be developed from the alar plate, and the tegmentum will be developed from the basal plate. The tectum has, or the posterior part of the midbrain, it has four rounded structures called colliculi. So if you look at this photo here, this represents the dorsal part of the midbrain, and these colliculi are the superior colliculi, and these are the inferior colliculi. They both play a role in vision and hearing. So the superior colliculi and inferior colliculi are lying as the dorsal aspect of the midbrain, which is developed from the tectum. And the tegmental part of the midbrain, which lies anteriorly or ventrally, this part is developed from the basal plate of the neural tube, and the cavity between both remains narrow to form the cerebral aqueduct of Sylvius. This cerebral aqueduct connects between the cavity of the third ventricle above, between the two thalami, and below with the cavity of the fourth ventricle, which is this part between the back of pons and back of what's called open medulla, and the cerebellum forming the roof of the fourth ventricle. This part will be discussed in more detail in the section of the brainstem and cerebellum. Now we will move to the development of the diencephalon. The diencephalon is developed from the median vesicle between the two telencephalic vesicles, which are all developed from the prosencephalon. So the proximal part of the vesicle of the neural tube will give rise to 3 vesicles, as we discussed before. 2 lateral vesicles, which will develop into the cerebral hemisphere, and they are called telencephalon, or the telencephalic vesicle, and median vesicle, and the median part, or the median vesicle. This is the diencephalic vesicle, which will be developed into the diencephalon. The diencephalon is consisting of 2 lateral walls connected together by roof plate and floor plate. And this is one lateral wall, and this is the other lateral wall, and these lateral walls are connected by roof plate and floor plate. The cavity between these lateral walls here will be narrowed to form the cavity of the third ventricle. The roof plate will be divided into anterior and posterior part. So this is the anterior part of the roof plate, and this is the posterior part of the roof plate, because each part will develop a different anatomical structure. The choroid plexus is developed from the anterior part of the roof plate. The choroid plexus, which will secrete the cerebrospinal fluid inside the cavity of the third ventricle, will be developed from this part. So here the choroid plexus will be developed from the ventral part of the roof plate, while in the posterior part of the roof plate, if you remember, a structure called pineal body or pineal gland that lies at the posterior end of the thalamus. This structure will be developed from the posterior part of the roof plate. And if you remember, in the sagittal section of the brain, we have a sulcus called hypothalamic sulcus. This sulcus separates between the thalamus and the hypothalamus. This is the hypothalamic sulcus, which separates between the thalamus above and hypothalamus below. This hypothalamic sulcus will be developed between both, which separates the diencephalon into these 2 parts. Lastly, the floor plate, which is this part, the floor plate will be developed into the posterior lobe of the pituitary gland. And this is the development of the pituitary gland itself, which is not included in our course, but if you want to have more information, please read this slide. The development of the cerebral hemispheres is very easy now to know how it is developed. They are developed from the telencephalic vesicles, which are developed from the proximal part of the neural tube, the prosencephalic vesicle, and the cavity which will be developed inside these telencephalic vesicles will give rise to the lateral ventricle inside the cerebral hemisphere. So these vesicles will be developed into the cerebral hemisphere, and the cavity inside will be the lateral ventricle. If you remember the middle mantle layer of the neural tube, which form the gray matter in the spinal cord. Inside the brain or inside the cerebrum, we have a collection of these gray matter, which is forming what's called basal nuclei of the brain. So the mantle layer inside the cerebrum will give rise to the basal nuclei or the caudate and lentiform nucleus, and these structures, which are collectively known as basal nuclei, are developed from the mantle layer of the neural tube. Lastly, the hemispheres enlarge and overlap the brain stem and the cerebellum, so that the end results, the cerebrum, are above, and the brain stem and the cerebellum are inside and below the cerebrum. Lastly, we will move to the congenital malformation or congenital anomalies of the development of the brain. First, congenital malformation is called hydrocephalus or hydrocephalus. The hydrocephalus is discussed before in the lecture of the brain ventricles, and this means increase in size of the head due to enlarged brain ventricle, due to enlarged brain cavity inside the telencephalic vesicle. And if you remember, it is divided into two types, internal or external. In case of internal hydrocephalus or hydrocephalus, the cerebrospinal fluid is accumulating inside the cavity of the lateral ventricle or in the cavity of the telencephalic vesicles. Or external hydrocephalus, in this case the cerebrospinal fluid is accumulating between the brain and the arachnoid matter inside the bia and the arachnoid matter inside the subarachnoid space. As you know before, hydrocephalus leads to the sunset appearance of both eyes and headache, vomiting, and other symptoms according to the severity of the case of the hydrocephalus. The second congenital anomaly is a condition called exencephaly. As you know, the neural tube at early stage of development has an anterior and posterior neuropores, which close at 25 and 27 days respectively. In case of failure of closure of the anterior neuropore, the vault of the skull is absent and the brain will be exposed outside, and this condition is called exencephaly. This is a stillbirth baby in which he has developed exencephaly due to failure of closure of the anterior neuropore with absence of the vault of the skull. And if the brain is degenerated in the previous condition, this condition is now called anencephaly. So anencephaly is a degenerated brain due to the same condition, which is the absence of the skull vault, and the brain itself is degenerated inside the skull. We have another condition which is called meningeocele. Meningeocele, in which we have failure of obliteration of the anterior neuropore and protrusion of the meninges outside a defect in the skull. This is called meningeocele. So you have here the sac, which is filled with the cerebrospinal fluid, is protruded from the defect of the skull bone, and this is called meningeocele. If this defect in which the sac of the subarachnoid space is protruded inside this sac, if we have a part of the brain herniated within this sac of meningeocele, this condition is now called meningioencephalocele. So meningioencephalocele means protrusion of a part of the brain tissue inside the sac of meningeocele, and this is very dangerous condition. More dangerous than this, if we have something called meningiohydroencephalocele. So meningio means protrusion of a sac of meninges with the cerebrospinal fluid, and encephalocele means protrusion of part of the brain. And you know that the brain, inside the brain, we have the lateral ventricle. So if part of the lateral ventricle is also protruded inside the sac of the brain tissue, this is called meningiohydroencephalocele. Lastly, we have a condition known as holoprosencephaly. In this condition results from failure of development of all midline structures between both eyes, between both opening of the nose, and the midline structure in the mouth cavity. So all midline structures are obliterated, and this results in a fusion of both lateral ventricles and both orbits and nasal cavity.
Welcome to 2-Minute Neuroscience, where I simplistically explain neuroscience topics in 2 minutes or less. In this installment, I will discuss early neural development. The development of the nervous system begins at around the 3rd week of embryonic development, when an area of the ectoderm, or the outer tissue layer of the embryo, thickens and forms what is known as the neural plate. This plate begins to fold inward, forming a groove called the neural groove. The sides of the neural groove, known as the neural folds, begin to come together. At the end of the 3rd week, the folds will begin to fuse together. By the end of the 4th week, they have completely fused together to form the neural tube, which will eventually become the brain and the spinal cord. As the neural tube closes, bulges and bends begin to appear, and they gradually become more noticeable. During the 4th week, there are 3 of these bulges present. They are called the primary vesicles. They are the prosencephalon, which will eventually form the cerebrum, the mesencephalon, which will eventually become the midbrain, and the rhombencephalon, which will eventually become the rest of the brainstem and the cerebellum. The end of the neural tube will form the spinal cord. As the brain continues to develop, 2 of these vesicles further subdivide to form secondary vesicles. The prosencephalon forms the telencephalon and the diencephalon. The telencephalon will become the cerebral hemispheres. The diencephalon will eventually consist of the thalamus, hypothalamus, and other structures. The mesencephalon does not subdivide any further and will become the midbrain. The rhombencephalon will subdivide into the medencephalon and the myelencephalon. The medencephalon will become the pons in the cerebellum, and the myencephalon will become the medulla. The spinal cord will still form from the end of the neural tube. Next, the neural tube will continue to develop to look more like the brain. The telencephalon will grow more rapidly than other parts of the tube, and by 11 weeks, the brain will have a similar shape as to what it will at birth. Although it will continue to develop after birth, the brain at birth is structurally similar to a fully developed brain.
Now we have reached to the end of the lecture, in which we discussed the brain, brainstem, and the spinal cord development, and also the congenital anomalies, which could be resulted from the abnormality in the process of normal development. I hope you enjoy the lecture, and meet you again in another online lecture. Thank you very much.